I've been the organiser of this year's meeting along with Omar Divaja and Nikos Burbos in the organising committee. Scientific committee come from all around the UK. And it's the first time we've done this actually. It's based in London, but combining with hospitals in smaller cities where it's more difficult to host conferences, so they can be involved in it. Of course, being in London, most of the work has ended up being with me, but most of the major decisions have been joint decisions. So I hope it's been a successful conference, and people have told me they've really enjoyed it, so that's a reflection of everyone's work, all three of us. My highlights, I suppose, have been the surgical bits, actually. I mean, I really enjoy all the chemotherapy bits, and it's really important that we all come here as a multidisciplinary team. But in the end, the bits that really get me ticking are the surgical ones, and we've had some fantastic surgical presentations. I think Professor Sibila, Professor Dubois have been particular highlights. I mean, they're really senior, world-famous surgeons who have come along and delivered excellent speeches, and Professor Dubois is always quite humorous as well, which is really nice too. And then there's some other things, because I've chosen that subject and particularly asked for the speakers to come who've come, and they delivered great talks. So we just had a talk about aspirin in prevention, which was great. We had another talk in the new opportunities for therapies about HIPEC that I'm quite passionate about. And then we had a section on tumours that are difficult to treat, and we had thoughts about operating from Professor Levine from the States, and his talk also was excellent. But I think actually the quality of all the talks have been brilliant, even all the way through to the proffered papers, where young people come and give us a 10-minute talk about their research, which is really tricky, and they were all fantastic. And the winner of the prize, who will be announced shortly, was consummately professional, delivering us a talk that was well above her years, and you'd expect something, nothing as good as that. So it was really impressive. Well, Professor Sibila talked about resecting the pelvic side wall, which has previously been thought that if you had recurrence on the pelvic side wall, that person couldn't be treated. And over the years, I've done some pretty big resections on the pelvic side wall, and it's difficult because sometimes it works and it's amazing. You've saved someone and nothing else could have done it, but sometimes it can go pretty badly wrong because or rather it just doesn't work, and the patient has disabilities afterwards, so nerve damage and, for instance, weakness in the leg. And then when you come along and see a presentation like we had from Professor Sibila, who went through his work that's very similar, and once shows you some added things you can add to what you want to do, but also is a little confirmation that what you've been doing is the right way, because you need the support of colleagues to be doing the same things. So that for me was a big highlight. Well, I think this meeting, perhaps every year actually, they get a little bit more multidisciplinary. So we had 50 nurses here. I don't know how many medical oncologists there are. It's tens, not hundreds. We've had about 100 unit leads. We've had a lot of gynae oncologists and junior docs. And it's the whole team. It's the team that works together in a hospital. They can come to a conference like this and learn together, learn about each other's things. For instance, the chemotherapy doctors, I don't think know that much about surgery. And having surgeons from abroad talk about it, actually the physical doing it as opposed to the results of studies, I think that's great. Because we learn a lot about all these PARP inhibitors, and it's really nice to have that that passing across of knowledge. And then, of course, we go out to dinner, so it's all team building and team working.